Now we will discuss anatomical division of pelvis. Female bony pelvis is divided into false pelvis or greater pelvis and true pelvis or lesser pelvis by pelvic inlet. False pelvis or greater pelvis lies above the pelvic brim and has no obstetric significance and contains small intestine and large intestine. True pelvis or lesser pelvis lies below the pelvic brim and has important role in childbirth and delivery, and it contains bladder and reproductive organs. True pelvis or lesser pelvis forms the canal through which fetus has to pass. It is divided into pelvic inlet, pelvic cavity, and pelvic outlet. Pelvic inlet lies at the level of pelvic brim. Pelvic cavity or mid pelvis lies at the level of ischial spine. Pelvic outlet lies at the level of ischial tuberosity. Flow chart shows division of bony pelvis into false pelvis or greater pelvis and true pelvis or lesser pelvis. Second pic shows sagittal view of false pelvis and true pelvis divided by pelvic inlet. This slide explains the division of bony pelvis by superior view, coronal view, and sagittal view. In superior view, red line shows the pelvic brim, green color shows greater pelvis or false pelvis, and yellow color shows lesser pelvis or true pelvis. Coronal view also explains the division of bony pelvis into false pelvis and true pelvis, and it also explains the division of true pelvis into pelvic inlet, pelvic cavity, and pelvic outlet. False pelvis lies above the pelvic brim and true pelvis below the pelvic brim. Inlet lies at the level of pelvic brim, mid cavity lies at the level of ischial spine, and pelvic outlet lies at the level of ischial tuberosity. Sagittal view also explains the division of bony pelvis into false pelvis and true pelvis by pelvic inlet, and also explain the division of true pelvis into pelvic inlet, pelvic cavity, and pelvic outlet. Now I will explain walls of false pelvis and true pelvis. Walls of greater pelvis or false pelvis are formed by the following structures. Interior wall is formed by muscles of interior wall of abdomen. Posterior wall is formed by fifth lumbar vertebra, the base of sacrum, and iliolumbar ligament. Lateral walls are formed by wings of ilium. Now we will discuss walls of true pelvis or lesser pelvis. Walls of true pelvis or lesser pelvis are formed by following structures. Interior wall is formed by pubic bones and pubic symphysis. Posterior wall is formed by sacrum and coccyx. Lateral walls are formed by ischium, obturator membrane, sacrotuberous, and sacrospinous ligament. This slide shows the measurement of true pelvis. As we have already discussed the walls of true pelvis, and true pelvis is interiorly bounded by pubic symphysis, it measures 4 cm, and posteriorly true pelvis is bounded by sacrum and coccyx, and it measures 11.5 cm. And this flow chart shows the division of true pelvis into inlet, cavity, and outlet, and division of outlet into obstetrical outlet and anatomical outlet.